Okay. Okay, hello everyone. My name is Julia Kirkland. I am one of the Joplin Anatomy Fellows, and I am with the COM 2027. And my second author is Adam Yusuf, is from COM 2028. And my principal investigator was Dr. Lion Huff. And my project is on the anatomical considerations in surgical intervention for lateral ankle instability. So the outline that we're going to cover today is the introduction, objectives, methods, data and results, conclusion and further direction, and then a slide of my references. And then I'm going to move okay. So lateral ankle instability is a common orthopedic condition affecting 20 to 40% of patients who experience initial ankle sprains. So these chronic instabilities develop in approximately 10 to 30% of cases, significantly impacting the quality of life and athletic performance. Lateral ankle instability has been known to compromise the triad, such as the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneal fibular ligament. The fibularis brevis, fibularis longus, and if present, the fibularis tertius provides additional structural support. Out of the three, the anterior talofibular ligament is the most common one out of the three that are compromised. So lateral ankle instability is characterized by persistent anatomical structures giving away, recurrent sprains, and functional limitations. And the injury has significant impact on elite athletes, professional dancers, and the general public alike. So there's two primary surgical interventions used to improve lateral ankle instability. The two are the Broadstrom-Evans procedure, and then the second is the modified Broadstrom procedure, also known as the Broadstrom Gold. And the choice between the two of the Broadstrom-Evans and the Broadstrom Gold procedures depends on several anatomical and clinical factors. So the indications for the Broadstrom-Evans procedure is significant ligamentous lacticity, cases with poor quality of the anterior talofibular remnants, athletes requiring enhanced stability, individuals who have higher body mass index, and or cases where the fibularis brevis measurements indicate adequate tissue for transfer. And then indications for the Broadstrom Gold is good quality ligamentous tissue, cases with adequate inferior extensor reticulums, non-athletes, recreational athletes, normal body mass index, and or cases where the reticular measurements suggest sufficient reinforcement potential. Some of the challenges faced in these procedures are inadequate remnants of tissue and replicating tension. These challenges can result in complications such as recurrent ankle instability, joint restrictions, and or pain. So physical factors such as height, weight, sex may play a role in these challenges surgeons are faced with. So here's an example of the Broadstrom-Evans procedure. This surgical procedure that involves the fibularis brevis tendons, and they're sectioned proximally. They're sectioned proximally and transferred through the lateral malleolus and then anchored to the lateral malleolus itself, leaving the remnant of the tendon to be sutured to the fibularis longus tendon. So you can see that here. So you can see that here. And then next we have the Broadstrom Gold procedure. This is the one that's more commonly used, but this procedure, you take the inferior extensor reticulum. It's used to reinforce the repaired damaged anterior talofibular ligament or attach it directly to the anterior talofibular ligament remnant at the lateral malleolus, which you can see here. So the objectives the purpose of the study is to define the anatomical characteristics of the fibularis brevis muscle, tendon, and then the fibularis tertius tendon, inferior extensor reticulum, and their relationship to the fibula with comparisons to the physical factors such as height, weight, and sex. So understanding these challenges and the potential of anatomical considerations to mitigate poor procedural outcomes is essential to improving patient outcomes. So now I'll go into the methods. This is kind of long, so just bear with me. So I did the study on 58 cadavers between the Kansas City campus and the Joplin campus between August and October of 2024. So 33 male donors and then 25, 33 female donors, 25 male donors, and then the height, weight, and age were recorded from previous records. And the lateral part of the leg was dissected bilaterally. So to expose the fibularis brevis muscle, belly, and tendon inserted on the 5th metatarsal bone, and then the lateral, anterior, and medial ankle was dissected bilaterally to reveal the extensor inoculum of the foot. And then the fibularis tertius tendon, if present, was dissected to insert into the surface of the 5th metatarsal bone. And those were measured with a flexible measuring tape. And then measurements were taken of the fibula bone bilaterally from the fibular head to the end of the lateral malleolus. And then measurements were taken bilaterally of the inferior extensor inoculum's length and width. And so, so the fibula bone was used with measuring tape, and the measurements with the inferior extensor inoculum, I used a digital caliper. So the distance from the thickness of the band of the inferior extensor inoculum to the lateral malleolus, the distance from the fibularis brevis tendon to the lateral malleolus, the width of the fibularis brevis muscle, the length and width of the tendon, and the length and width of the fibularis tertius were recorded. And then the bilateral, or the length of the fibularis brevis from the origin of the muscle to the insertion of the tendon was also recorded. And so I used calculated correlations from the study variables, and I used that for the statistical analysis. So data and results. So the that's a typo. I would say the median height and weight of the NHs were recorded at 167.64 centimeters with a range of 142.24 to 195.58. And the median was 150 pounds, and then the median age was 77 years old. So the 18 donors did not have the fibular tertius muscle or tendon present, so that represented 38% of the sample population. Male donors demonstrated longer fibularis brevis, or longer fibulas than female donors with a 12% difference, and the width of the fibularis brevis muscle was greater by 36% in male donors when compared to female donors. And then the extensor, the inferior extensor inoculum dimensions exhibited minimal sex variation. So after generating the correlation matrix, trends suggested strong positive correlation of a 0.93 between the length of the fibula and the length of the fibularis brevis. The results were also notable for bilateral discrepancies in several parameters. For instance, the fibularis length showed variations between sides in many of the donors. So there was another strong correlation with 0.91 was demonstrated between the lengths of the fibularis tertius tendon and the width of the fibularis tertius tendon. There was a moderate negative correlation of a negative 0.52 between sex and the length of the fibula. Height and weight showed a strong correlation with 0.68. Weight showed a moderate negative correlation with negative 0.49 with sex. And then the inferior extensor inoculum width and length showed asymmetry bilaterally. And then significant narrowing of the width of the inferior extensor inoculum of less than 20 millimeters may indicate reduced support. Asymmetry bilaterally in the inferior extensor inoculum measurements greater than 5 millimeters could suggest instability risk. So a shorter inferior extensor inoculum length of less than 100 millimeters may provide insufficient support. And then the narrow width measurements less than 15 millimeters of the fibularis brevis muscle may indicate weakness. And then the fibularis brevis muscle had asymmetry with bilaterally. And a shorter fibularis brevis muscle length relative to the fibula length could indicate reduced stabilizing capacity. So larger differences between the inferior extensor ranaculum and the fibula over 50 millimeters may indicate laxity, and those asymmetries distances bilaterally could suggest uneven support. So as expected, male donors generally demonstrated larger measurements than females, and age influenced those measurements. And so basically, this is the graph of the correlation matrix that is basically just covers exactly what I just said. So in conclusion, the anatomical variations identified in the study provided valuable insight into the lateral ankle stability and surgical decision making. The strong correlations between the fibula length and the fibularis brevis tendon measurements suggest that these anatomical structures play a critical role in determining the success of reconstruction procedures. And then additionally, sex-based differences, bilateral asymmetries, and the variability in the fibularis tertius tendon presence highlights the need for individualized surgical planning. So, and then implementing standardized measurement protocols and considering individual anatomical differences, the surgeons can optimize patient outcomes by tailoring the graft selection, fixation techniques, and ligamentous reconstruction for each individual's anatomical needs. So these considerations will lead to more evidence-based decision-making, improved surgical precision, and better long-term functional outcomes. And so just some future directions with for this research. Further research should be aimed to track anatomical changes over time through longitudinal studies, and then assessing the correlation between asymmetries and clinical outcomes to refine patient selection criteria and examine the influence of environmental factors and demographic factors on anatomical variations. Additionally, further investigation into how natural asymmetries impact reconstructive techniques, such as the Broadstrom procedure, is warranted. And these investigations will provide a more comprehensive understanding of lateral ankle instability and contribute to the refinement of surgical techniques and post-operative protocols. And I was a little nervous. And so, but here is where, just an example of how I took those measurements. This picture is just giving the width used with that digital caliper to do the inferior extensor ranaculum. Okay, and that's my references, and that concludes my presentation. Please let me know if you have any questions.